Hi, and welcome to Edpuzzle 2. I've found my headphone set, so I'm hoping this will limit the background noise from my obnoxious dog. So in this brief lecture, we're going to talk about the core principles in A&P, because it's really important that you understand these basic themes of anatomy and physiology, as it will really help you as you learn material in A&P 1 and 2. So the first theme is homeostasis, and we know that all body systems work together to maintain a stable internal environment. That's kind of the definition of homeostasis. So what does this even mean? Well, what it means is we try to have a range that our body systems always operate to keep things normal and healthy. In fact, disease is when the body loses control over homeostasis. So what kinds of things do we maintain homeostasis over? Well, just pretty much everything. Think about things like your heart rate, blood pressure, body temperature, blood glucose levels. So everything has a normal range, and so your body system is going to have mechanisms in place to know what's going on in the body and also to maintain that range. So again, when we look at homeostasis, a lot of times we just talk about temperature. Like, it's real easy. Everyone has a thermostat in your home that you change the temperature if you're too hot or too cold. And the body's similar in that there's a few things that we always have, a few pieces to this. So the first thing is we always have receptors. And receptors are structures that respond to a stimulus. You might remember in the last lecture, we said living things respond to stimuli. In this case, it's called a thermometer, right? Inside that thermostat. But you would have thermoreceptors in your body that are always looking at your body temperature. So this receptor responds to the stimulus and it sends that information to a control center. Now, the control center in our body is usually our brain, but the control center takes that information and processes it and decides what, if anything, needs to be done. Now, if something needs to happen, the control center sends the command out to the effector. So the effector is what carries out the response. It carries out the commands. So maybe it's muscles, or maybe it's digestive organs, or maybe it's an endocrine organ. So it's going to basically carry out the instructions. And when the effector carries out the instructions, you get your response occurs. So in this case, again, there's a change in the temperature in your house. So in this case, we're saying you get too warm, temperature went up, that was the stimulus. The receptor responded to the stimulus, communicated the information to the control center. The control center sent the command, turned the AC on, and the room temperature then fell. So again, overview, good analogy for how the human body works. Now, what we often use is called a negative feedback loop, and that's actually what you just saw. So most of our automatic responses we automatically maintain homeostasis. We don't have to think about it. Is negative feedback because the response negates or does the opposite of the stimulus. So if something goes up, negative feedback brings it back down. Or if something goes down, negative feedback brings it up. So it's going to correct it, bring it back into homeostasis or back into that normal range. So we look at the human body now, instead of your house, the hypothalamus is the control center. The hypothalamus is a region inside your brain. And so again, we're going to have some sort of disruption in homeostasis. So let's say body temperature goes up. Well, when your body temperature goes up, you're going to have receptors. Now, in this case, the receptors are called thermoreceptors. They send information to the control center, and the control center tells the effectors, hey, we need to fix this. So it makes your blood vessels dilate. Now, blood vessels contain a lot of smooth muscle, and it also activates your sweat glands, so you start to sweat. And when you sweat and when your blood vessels dilate, that's going to help lower your body temperature and bring your temperature back down and restore homeostasis. So that's why this was negative feedback. So again, if we have a situation where body temperature goes up, we're going to carry the information to the control center. We're going to sweat and vasodilate. When you vasodilate, more blood flows to your skin, so your skin might turn red or pink and feel warm, but that's your body's way of releasing heat from inside. The heat basically travels through your blood where it can be dissipated through your skin. Well, the opposite. What if it's very, very cold? Well, in this case, the receptors monitor that it's cold outside. They still send information to the control center, the hypothalamus, but this time the effectors respond differently. They're going to vasoconstrict. You might notice that your fingertips turn blue because they're decreasing blood flow. They're keeping that heat in your core. So, and you also can shiver. Shivering is smooth muscle contractions to generate body heat. So this whole negative feedback loop works all the time in our body. And when we're looking at it, again, if something goes up, it brings it down. If it goes down, it brings it up. Another really good example is if we look at these two hormones. Now, these hormones are called antagonists, and you're going to learn this word soon anyway, but this is an A. Antagonists have the opposite effect. So we're looking at insulin and we're looking at glucagon. Now you might know that they both come from the pancreas. The pancreas is an endocrine organ, but they have very different effects. Their job is to maintain homeostasis of your blood glucose levels. If your blood glucose levels fall too low, it affects your brain and you could have a seizure and you could even die. And we also don't want it to be too high. It's like Goldilocks. We have to keep it just right. So if you eat a meal, and when you eat, your digestive system breaks the food down and then you absorb the glucose, the blood glucose level goes up. Well, that tells the pancreas to release insulin. And insulin's job is going to take glucose. It's going to actually tell your liver and your tissue cells, hey, take glucose. In fact, insulin unlocks a door to a specific receptor, to a specific little protein that lets glucose into your cells. So when you release insulin, it's going to open up those glucose doors. Glucose goes into your cells, it leaves your blood, so your blood glucose goes back down to normal. Hence, we've corrected the situation. Or what if you haven't eaten? So you haven't eaten, your blood glucose levels are falling. Well, that's a problem because I mentioned briefly neurons, right? Neurons are the cells in your brain, and red blood cells can only burn glucose for energy. So they need glucose all the time. So if the blood glucose levels fall, the pancreas is triggered to release glucagon. Now, glucagon does the opposite. It goes after your liver and skeletal muscle, and it takes that glycogen, which is that storage form of glucose, breaks it down into glucose. So again, that would be catabolic. Remember, if you take something big and break it down, and then it releases glucose into your blood. So by the way, when we were looking at insulin, trying to get another color here, over here in my liver, remember insulin is going to put glucose into my cells. And so what your liver does is it takes glucose and it packages it into glycogen, right? So it's going to be an anabolic hormone. Insulin is building. And these were terms that I told you guys to make sure you reviewed. So you have glycogenesis, which is building glycogen from glucose, or if you're breaking it down, remember that's called glycogen. Remember the last part? Lyse, glycogenolysis. Now, positive feedback is different. Just what it sounds like, it enhances the change. So in this case, you have a stimulus, but the effector augments or increases it. So normally this would kill us. So for example, if your blood glucose levels fell on the previous page, if you release if you released insulin and you kept bringing them lower and lower and lower, you would die. You would have a seizure. Remember, negative feedback is probably how 95% of our body works to maintain homeostasis. Positive feedback mainly happens to specific areas. When we talk about our blood clotting processes, that's positive feedback, and also labor and delivery for childbirth. So in this case, you have a stimulus, you have a change. So let's say you have a broken blood vessel and you start to bleed. Now there's cells called platelets. Platelets normally are not sticky. But when you damage a blood vessel, when there's a broken vessel, these chemicals are released and they make the platelets become sticky. So the chemicals are going to make the platelets sticky. And you can see them starting to be here. These little cells are platelets. And the platelets start to stick together. Well, when they stick together, they also release more chemicals then that's going to trigger more stickiness. So you have chemicals making platelets sticky. When they stick together, more chemicals are released, which make them stickier, and also affects your blood and makes your blood start to clot. So you get this whole positive feedback loop, which is critical, right? Because we don't want to bleed to death. So that's pretty important. If we look at labor and delivery, we're looking at something called oxytocin, which is a hormone. And so what's interesting is when the basically the baby, actually they now releases oxytocin to begin with. But when the baby releases the oxytocin, its head pushes on the cervix and it is going to send information up to the brain. The pituitary gland, which you guys should recognize as an endocrine organ, secretes a hormone, oxytocin. Well, oxytocin is a hormone, so it travels in your blood and it goes to the uterus. And it triggers uterine contractions. Uterine contractions trigger more oxytocin. So you get this increase in contractions and frequency and strength. And the point of those contractions is to help basically push that baby out. Now, another core principle is pretty important, especially when you look at muscles and bones. Whenever we look at just the shape, think about the shape of cells as well. I think this will help you. The structure determines the function. So often structures have a certain shape because of what they do. So a red blood cell, for example, is nice and round. Well, it's nice and round because that makes it flexible so it can bend if it needs to. If you think about when we look at tissues, we're going to have these really flat cells. They're called squamous cells. Well, a squamous cell is really flat because its job is basically just to form a small barrier. It allows a rapid exchange of nutrients. Some of our cells are going to be really big and long like this, like storage bags. Well, that's because they're going to store and release things. If you think about a neuron, it's branched so it can communicate. This is showing you your elbow joint, which we'll look at in Lab 1. And so the way that the bones fit together is it's called a hinge joint. So a lot of times if you look at the shapes of bones, you can figure out the joints as well. So structure always determines function. In this case, you can see where I was showing you these thin cells. I said squamous cells, they just form a very thin barrier, so they're really good for diffusion. But if you have a whole bunch of cells together, notice that's thicker. That wouldn't be a very good way to have diffusion. That would probably be better for protection. Another thing to keep in mind is that gradients drive everything. So when we look at physiology, anytime there's a temperature gradient, heat always travels from high to low, from high heat to low heat, basically. Anytime we look at concentration gradients, you guys all know that we move from high to low typically, unless we're moving opposite. Remember, if we're moving opposite, we're moving uphill, and that's called active transport. And then we also have pressure gradients, so that things in our body often follow gradients and move from high to low. So if you understand where you have the higher concentration or the higher pressure, you can predict which way it'll move. And then also cells have to communicate. Cells are alive. They have to talk to each other. And there's a few ways that they talk to each other. One of the main forms of control in your body is going to be with your neurons, and neurons are going to use what are called action potentials. And another word for an action potential is a nerve impulse. And remember, this is a wave of electricity. It's basically called a depolarization event. Sodium enters and they communicate through this electrical information. Now, when these nerve impulses hit a synapse, a lot of times you're going to release chemical messengers. So at a synapse, the chemical messenger you probably know is called a neurotransmitter. So these are going to communicate at synapses. And then we also have hormones, which are another form of control in our body. And hormones get released into your bloodstream, and then they travel throughout the body. Anywhere there's a receptor, they bind and have their effect. So this is an overview of some of the main core principles that I think will help you as you study the material. And I'm just going to wrap up just a little bit about common imaging results. So you've heard of x-rays before. We'll look at some x-rays when we look at bones. But basically, when you have an x-ray, it's radiation that passes through the body, and some of it passes through and some of it bounces back. So basically, any soft tissue like blood or fat or muscle is going to allow the x-ray to actually go right through, and it usually looks like a dark gray on the film. However, anything that has like calcium in it or is very dense, like bone or even tumors, are not going to allow the x-rays to pass through, and they're going to look white on the x-ray. So they're often used to look at different tissues. Now, this picture here, so again, you can see the heart is a little more dense. You can see the lungs are full of air. And in this case, you can see this little white area where it's less, which means it's more dense than the lungs, which means that that's a tumor or some sort of mass. And then we have what's called a barium contrast x-ray. So for this, you actually drink barium, and what happens is it makes it like opaque. So when you do the x-ray, you can visualize the inside of the large intestine. So this could be used to look for anatomical issues in the digestive system. Now, an ultrasound is different. It uses sonography. It uses sound waves. It's called ultrasound. And what happens is the sound waves are in the body. Now, understand that a ultrasound is sound. It's not x-rays. It's not radioactive waves. So they're safer. X-rays right now, they give you, it's not a lot of radiation that you're exposed to. I mean, you don't want to go get one every week, but it's not as dangerous as it used to be. Excuse me. Whereas an ultrasound is completely safe because it's sound waves. So the sound waves are used, that you can see, obviously we use ultrasounds to look at fetal imaging. And so based on the sound waves bouncing around, it bounces in, the transducer sends it back out, and it's able to give you an image. So sonography is usually used, obviously, babies, and it's also used for heart. In fact, you can do it's called an echo. Let me write this in there. Echocardiogram, or we just say echo. It's done a lot to look inside the heart. And so it's really good, especially if there's things moving around. So if you've ever been pregnant, the baby's moving around in there. Obviously your heart is beating. So it's a much safer way to see inside the body. Now, MRI and CT scan are better at soft tissues. Now they give you different views. An x-ray just kind of gives you, if I go back to an x-ray, you're basically just looking at an anterior or posterior view primarily when you're looking at that. You can't like cut and look inside. But what the MRI and the CT scan do is they kind of let you see inside, because you can actually get cross-section views as well. So you get more details with this. The MRI uses a magnet, CT uses the radiation, so slight difference in risk. But because the MRI uses a magnet, obviously if you have any kind of implants, you might not be a candidate for an MRI, depending if you have any metal in your body. You can see CT scans can be a little quicker, MRIs take a little longer, they can be really, really loud. But both of them are pretty good for soft tissue. So if you have like a tendon or a ligament issue, or they're looking at the meniscus in your knee, the MRI is the gold standard for that. A CT scan is good. You can use CT scans to look at blood vessels. It's a little less detailed, but they're both going to be helpful for looking inside the body. If you look at this picture, notice the better resolution you get on the MRI. So an MRI is usually preferable to a CT, but if you have, let's say, a stroke patient comes in and you need to find out if they're having a hemorrhagic stroke where the blood vessels are bleeding, or an ischemic stroke where there's a blood clot in the vessel, then you're going to want to use whichever one's available first, because they can both show you that. And then the PET scan uses a dye and radioactive tracers. So what happens is the tissues and organs kind of take up the dye, and the more active shows a different color. So they're kind of cool, showing areas of like cancer, because cancer cells are very, very active. In this case, you're looking at a brain scan and you're seeing the changes in the brain that can happen with Alzheimer's, and you can see the normal issue here, right? See all the red, and then you can see the lack of color shows a lack of activity in the brain. So this concludes chapter 1.